My name is Dr. Walter Matweychuk, and in this video, I would like to give you an overview of rational emotive behavior therapy. Rational emotive behavior therapy is the therapy that I practice, and it's a very powerful psychotherapy developed by Albert Ellis. And I would like to begin by pointing out to you that in rational emotive behavior therapy, we encourage you to learn what's called the ABC model of emotion. This framework is very useful for understanding your emotional upset. Whenever you get upset, anxiety, angry, depressed, you usually encounter some sort of adversity at point A. And the adversities that we encounter, you have generally very little control over or no control over whatsoever. And we perceive these adversities, and our perception may or may not be true. But in rational emotive behavior therapy, we don't, at first at least, challenge your perception. So if you see a threat, if you think you're going to get laid off, if you think you're going to be jilted in a love affair and begin to feel anxiety, we're not going to say to you, well, you know, maybe that's not going to happen. In other cognitive behavioral therapies, namely the cognitive behavioral therapy of REBT, there would be an effort to get you to evaluate this perception of reality to see if it's distorted. But in REBT, we begin with the assumption that your perception of reality is perhaps accurate, and what we're going to want to do is help you look at the underlying attitudes that you have about the grim reality that you are perceiving. So in the ABC model, we start with adversity, basic attitudes, and consequences. And in REBT, we show you that your basic attitudes have a profound influence over the consequences, over the emotional, behavioral consequences that you feel. So let's, for example, assume that you're in a relationship and there's a certain amount of anxiety that you're experiencing. You're not sure how long this relationship is going to last, and you're enjoying it. And most people, before they come into REBT, begin to think that, well, the possibility of a relationship ending is what's leading to my anxiety. And of course, when we're anxious, we also have behaviors that go along with the anxiety. We may avoid, we may use drugs or alcohol to keep us calm. We may have urges to procrastinate. That's kind of like avoidance. And then once we're anxious, we may even have subsequent distorted and biased thinking, meaning that once we're anxious, thoughts that go forward in time may very well be distorted, and we may jump to conclusions, or we may engage in all or nothing thinking. Now, our language biases us. If you speak to somebody and say, well, why are you upset? Why are you anxious? Very often people will say, well, it's the possibility of this great relationship ending that's leading to my anxiety. And in rational emotive behavior therapy, REBT, what we're going to do is make a distinction between healthy negative feelings of concern and unhealthy negative feelings of anxiety. And the big distinction between healthy negative feelings and unhealthy negative feelings is that the healthy negative feelings either help us do things that that might help us at point A. So if you're concerned and you're in a relationship, your concern will fuel your effort to go back and try to please your partner, try to do what you can without perhaps being inauthentic, but do what you can to be pleasing to the other person. And you approach problems where you talk about problems with concern, you problem solve. But the emotion of concern allows you to go back to A and do whatever you can do to prevent whatever it is that you're concerned about. Or if you can't do anything about it, to move on, to live with your concern and wait and see how things come out. Whereas with anxiety, we tend to engage in self-defeating behavior. So in REBT, what we try to show you is that rather than seeing the adversity, the threat to your relationship, the possibility of it ending, as the sole cause of your anxiety, we try to show you that you have basic attitudes that you bring to the situation, bring to the adversity, and these attitudes largely influence whether you feel healthy negative feelings of anxiety, unhealthy negative feelings of anxiety or healthy negative feelings of concern. Now, these attitudes that we have pretty much break down into four basic, what we would call self-defeating attitudes. These attitudes are generally, the characteristics of these self-defeating attitudes are that they're either rigid or extreme. So let me give you an example. Rigid attitudes are expressed with words like must, absolute, should, have to, need to. So for example, a person with a rigid attitude about a relationship that might end might say, I absolutely have to have this person in my life. And REBT theory says that when you hold rigid attitudes and you go and encounter an adversity, not only will you feel unhealthy negative feelings and engage in unhealthy behaviors, but that you're more than likely to also experience one or more extreme attitudes that are generated by your rigid attitude. So for example, if you were to say to yourself, I absolutely must have this person in my life, you're also likely to say, it would be awful if we broke up. It would be awful if we broke up. Or we might say, it would be unbearable to live without this person. I must have them in my life. It'd be unbearable if I didn't have this person in my life. Or we might depreciate ourselves. So REBT encourages people not to do this, but when you hold a rigid attitude, very often you will depreciate either yourself, another person, or life itself. So let me give you an example within the context of this relationship example that I'm talking about. You hold the rigid attitude, I have to have this person in my life. It would be awful if I broke up. It would be unbearable to live with them. And it would prove that I am worthless. So you would be depreciating your human worth and hold the attitude that it would prove that you are worthless. Now in REBT, we challenge people to see that, we encourage them to see that these attitudes that we hold at point B in the ABC model are completely under our control. What you think, what you believe is what you believe. And you could choose either unhealthy attitudes, rigid and extreme attitudes, or flexible attitudes and non-extreme attitudes. So again, within the context of this example, rather than saying I absolutely must have this person in my life, you might say, I really want this person in my life. I really want them in my life. And if we were to end our relationship, if it were to run its course, that would be bad, but not awful. That would be very bad, but not awful. Or you might say, I really want this relationship to continue. And if it ended, it would be very, very difficult, very uncomfortable, but it would not be unbearable. Alternatively, you might also think, I really want this person in my life. I really desire this relationship to continue. And if it didn't, that would be bad. but the whole of life would not be bad. Life would still have good aspects to it. And if I did something that contributed to the breakup of the relationship, that would be a negative characteristic that I would want to look to change so that in future relationships I might not repeat that behavioral pattern. But that the whole of me, that wouldn't constitute me thinking or seeing myself as worthless, the whole of me, worthless as a person. Now, think about this. If you say, I want this relationship to continue, but it doesn't follow that it has to continue, then you're going to feel concerned about the possible threat to the relationship, about the possibility of it ending, but you're not going to be quite anxious. You're not going to be anxious. You might be quite concerned, but that's still very different than anxiety. So one of the unique aspects of REBT, which I find particularly good, is that we make a distinction between unhealthy and healthy negative emotions. In rational emotive behavior therapy, when bad things happen, it's sensible to have healthy negative emotions. So when you face, for example, a threat of some sort, like in the example I'm talking about, then it's very sensible to be concerned. But we're going to argue that that is very different than anxiety. That even quite a bit of concern is still not the same as anxiety. Because these are similar in tone, these two, the healthy negative emotion and the unhealthy negative emotion, but they're different, they possess different characteristics. And consequently, we're going to argue that people have a choice, that REBT enables you to have a choice in choosing your emotions in response to whatever adversities that you have. Now, REBT also trains you to use language that's a little bit uncommon, but very useful and very liberating emotionally. So rather than saying the threat to the possibility of my relationship ending with this person is making me anxious, we would encourage you, I would encourage you in psychotherapy with me to say to yourself, and think this way, actually think this through, I make myself anxious about the possibility of my relationship ending. I make myself anxious about the possibility of my relationship ending. And if I'm making myself anxious, then I could choose to no longer continue to make myself anxious. I could choose concern. Now, in order to make that choice, I'm going to have to hold a different attitude about the possibility of the relationship ending. Instead of holding the rigid attitude that the relationship must continue and I couldn't bear for it to end, I'm going to have to say to myself, in order to get to concern, I'm really going to have to believe too, I really want this relationship to continue, I desire it, I prefer it, I want it, I wish it, but it will not be the end of the world if it ends, if the relationship were to run its course and end. It will be bad, but not awful. It will be, for a period of time, uncomfortable to go about my business without this relationship, without this person in my life, but it won't be unbearable. It won't be unbearable for me to live my life. Now, think about how liberating that is when you have a want, a wish, a strong preference, but that you have thought through and developed the attitude and have conviction in it that the end of the relationship will not lead to a state that is unbearable. And what REBT does is train you to use this ABC model with all sorts of emotional problems, whether they be problems having to do with anger, problems having to do with jealousy, problems having to do with depression, So what we do is we teach you this ABC model, and the first aspect of REBT that we encourage you to think about and adopt is what we call the principle of emotional responsibility. The principle of emotional responsibility is the idea that our basic attitudes have a profound impact, a profound consequence on our emotions and our behaviors. And that we do not blame adversity for disturbing ourselves. We take responsibility for our emotional responses, our unhealthy emotional reactions, and when we notice that we're engaging in experiencing an unhealthy negative emotion or engaging in an unhealthy behavior, we then assume that there is a basic attitude that is present that's leading to this unhealthy negative emotion. Albert Ellis was very good at distilling a lot of information and packaging it in a way that was succinct. And if you are disturbed, it would be good for you, if you're noticing that you're anxious or angry or depressed, you might want to stop and make the assumption that you're engaging in one of three rigid beliefs, rigid attitudes. One would be, I absolutely must perform well. I absolutely must perform well. And if I don't, then I am less worthwhile as a person. And that will very often lead to anxiety or shame, that attitude. The second attitude that you might assume you're experiencing if you're having some sort of unhealthy negative emotion is where the attitude's directed at the other person. You must treat me nicely, fairly, as well as I think that you absolutely should. You must do that. And if you don't, you're a bad person. So you see the depreciation of the other person. In the first instance, I was putting the rigid attitude on myself. I must do perfectly well. I must perform perfectly well. Or else I'm a worthless person, or I'm a bad person. In the second core irrational attitude of REBT was saying that the person may think that place the attitude on the other person. You absolutely must treat me kindly, nicely, warmly, or you're a bad person. And then the third core irrational attitude of REBT is the attitude where we direct our rigid attitude towards life conditions, the world. So it might be, the world absolutely should give me what I want, when I want it, or else life is totally bad and it's probably not worth living. So there you have it, the three core attitudes of REBT. So the idea is that when you're experiencing emotional upset, and there are 8 basic unhealthy negative feelings, but let's, for our purposes of this video, focus in on just a couple. Let's focus in on anxiety, anger, depression, and shame. That you assume that you're holding one of 3 core rigid attitudes. And those rigid attitudes could be put on yourself. I must do perfectly well. Or I might put the rigid attitude on another person. You must treat me as I want you to treat me. Or life itself must be as I think it should be. Now, that's pretty good, right? Emotional upset, look for 3 basic ideas, and you'll find one of them. It's very, I'm going to challenge you to be upset and not have one of those 3 core attitudes. Now, you may also have one of the extreme attitudes, because the theory of REBT says that you go from rigid attitudes to extreme attitudes. So let me just summarize and move towards conclusion for this video. REBT is the original cognitive behavioral psychotherapy. It was developed by Albert Ellis, and he started his work in developing this therapy in 1955. And it's different than other cognitive behavioral therapies. There's another popular cognitive behavioral therapy pioneered by REBT, but that didn't really come along until 1967. It didn't start its evolution until 1967. So you see that Albert Ellis was the original creator of the cognitive behavioral movement in psychotherapy. And this was a departure from psychoanalysis, and where the psychologist, the psychotherapist is making the argument that it's our attitudes in our conscious mind or in our that are just lightly unconscious and that we could reflect upon and quickly pull into consciousness that really have profound consequences on our feelings. And it's not our upbringing, it's not the past. And this is where Ellis and eventually REBT moved away from the psychoanalytical tradition of looking into the past in order to understand patterns of emoting and behaving in the present. So REBT was the original cognitive behavioral therapy, and it has some overlap with Beck's cognitive therapy, which was developed at the University of Pennsylvania. However, there are important differences, and in a future video I will discuss some of these differences. But suffice it to say that I've worked with both of these very pioneering psychotherapists, and I tilt towards the REBT model. I think it has certain advantages that, like I said, in future videos I'll discuss. But the point being for now is that I want you to understand the ABC model, and the ABC model states that adversity at point A does not produce our unhealthy negative feelings, that essentially our attitudes at point B about the adversity have profound consequences on the feelings that we experience at point C, and that we have a choice between healthy negative feelings, which will enable us to deal or address head-on the adversity, or move on if there's nothing we can do about it. So in REBT, we emphasize the principle of emotional responsibility. The principle of emotional responsibility says, I make myself upset about the adversity that I encounter. Adversity doesn't make me upset. I disturb myself about it. And this is profoundly liberating. It's one of the reasons why I practice REBT, because I see it as an approach to psychotherapy that is efficient. In other words, we don't spend a lot of time, wasting time, talking about irrelevant aspects of a person's life. We zero in on the attitudes that they hold about themselves, other people in the world, that get them into trouble, the rigid and extreme attitudes. And we pretty quickly explained it under the ABC model and the principle of emotional responsibility and the distinction between healthy and unhealthy negative feelings. And then we talk about how to change these attitudes. Now, changing the attitudes is really where the rubber meets the road, because you can understand REBT, but you need to relinquish your rigid attitude that you have to do perfectly well, or other people must treat you exactly as you want to be treated. You need to relinquish them for flexible attitudes like, I want to do well, but if I don't, it doesn't follow that I have to do perfectly well. Or I want you to treat me well, but it doesn't follow that you absolutely have to. And I want the world to be a certain way, just and relatively comfortable, but it doesn't follow that it has to be this way. So getting people to move from rigid attitudes to flexible attitudes is really the core process of REBT in terms of producing emotional change. And in another video, I'll talk about the different ways we do that. But for now, I always like to begin with telling people you have to understand REBT in order to use it. So in REBT, there are a certain basic number of concepts that you have to first understand, one of which is the ABC model. Another one is the principle of emotional responsibility, the relationship between our attitudes and our unhealthy reactions at point C. You need to understand the difference between a healthy emotional reaction and an unhealthy emotional reaction. Essentially, the unhealthy ones are self-defeating. They don't help us change what we can change or to live gracefully with what can't be changed. Whereas the healthy negative emotions allow us to live well with things we can change, but to also work at changing whatever we can change at point A. So I'd like to close by saying that my goal is to make this website very useful for the dissemination of REBT. And so I would urge you to take a look at all my blog postings and read them to understand them. There are many books on REBT which are linked through this website, so you can read books on REBT. There are some old audios that I made some time ago that are still available. But now I'm moving to a video format because I think that REBT is an educational psychotherapy, and I want to find the best way to get this across to you. And I think the audio-visual aspects of my presentations will steadily improve as time goes on. And so I would encourage you to come back to my website and look at the future videos. But in the end, I'd like for you to just remember one thing. If you take one takeaway from today's presentation, I think that takeaway should be that I disturb myself. And if I disturb myself about the adversities I encounter, then it's up to me to not disturb myself, undisturb myself, and I don't have to wait for other people to change, or I don't have to wait for the conditions of life to change before I begin to have an improved emotional reaction to the problems of my life. So thank you very much for your attention.